why is everyone fasting? Like some type, some variation. There's always someone fasting. Why is it such a craze now?
The intention. Yeah. You cannot fast to death, but you can starve to death. So it's not a matter of 16:8 and the timing. It's about reducing your frequency of needs. That is the whole idea.
But there are people who get hungry early in the day. There are others who, like for me, I'm not even hungry at early in the morning until maybe 11.
And that means you're normal, because studies have shown that people are most angry at 8 at night, not in the morning.
Oh, in the 8 hours, if you go binge, you just eat and eat and eat. Won't that now kind of throw that off and you even end up putting on weight instead of if your body's in ketosis?
Okay. Actually, they say any fasting above 72 hours should be done under medical monitoring.
Oh,
yes.
Like continuous.
Yes, if you're continuing, like you're not having food or you're not having water for that period of time, more than 72 hours, do it under medical monitoring.
So you organize an office breakfast, spread everything on the table, and then someone says, no, I am only vegan. Someone else says, no, I'm just a vegetarian. And then the other one says, it's not yet my time to eat. I only start eating at 2. Welcome to the Med Squad podcast. If you have experienced this stress or you are the cause of this stress, let's talk. Let us talk. We're going to be talking about fasting, fat burn, and health. And of course, I have my panelists with me. Start this side.
Hello, I'm Dr. Flavia Bagacha, and I'm a medical officer.
Welcome.
And thank you.
Mr. Skip.
Okay, thank you very much, Jafesi. I'm Anthony Legua, a general medical practitioner.
All right. Now, the question, of course, because we're going to get a bit raw and real and relatable, and you like that. Yeah, a bit too much. But why is everyone fasting? Like some type, some variation. There's always someone fasting. Why is it such a craze now?
It has become more of a trend now because of pop culture and also more research medically. Yeah, it has opened up people's eyes to the benefits of fasting than what we had earlier.
So is the medical research also social research? Because sometimes people...
Yes. In fact, you can even trace back fasting from all religions. There is no religion without fasting.
Yeah.
So you'll see Christians, they do fast. See Muslims, they fast. So on the social context, fasting is still has a lot of benefits. So as much as there's medical backup, social backup is still there.
Okay, so one of the biggest trends, and also of course been exacerbated, even I can use big words, by TikTok, intermittent fasting. Oh, I only start eating at 2:00 and then I only drink black coffee. So is there a difference in depending on which fast you choose, intermittent or just straight fast, dry, the other one wet? Is it wet? Liquid fast?
Okay.
There's a difference.
Yeah.
There's intermittent fasting, yes, where people do, most common is 16-8. They do 16 hours fast, then they have an 8-hour period of eating. For example, you start eating at midday. So you do midday, from midday to 8 p.m. And then after that, the rest of the hours you're fasting. That's intermittent fasting. Depending, but that's average. Then there's also the keto diet.
Yes.
You fast until you get to ketosis.
What is ketosis actually? Now that finally I get to ask. What is ketosis?
So basically, ketosis is the breakdown of fatty acids. What happens? The fatty acids are broken down, and then one of the metabolites is the ketones. So the ketones are a source of energy. Usually the main source of energy is glucose through ATP, yes? But then if the body cannot access the glucose, it goes on to break down the fats. And then when you break down the fats, you get ketones, and that's what the body is going to use. So in a controlled fasting, ketones are good. Yeah. But in certain cases, we get something called ketoacidosis, which is now unhealthy, and that's when you get to the bad side of the thing.
Ketoacidosis.
Of the whole process.
Yeah. The acid inside there.
Yeah.
Exactly.
Yeah, I'm picking up those words. Okay, so
Just to add on what she has just said, for somebody to understand fasting, you need to realize just like vehicles, they have fuel. Humans, we also have some fuel we use.
yes.
That is why we have energy, the way I'm speaking, and some form of temperature. It means I'm burning something. So the question is, what are you burning, Anthony? So for example, now I am burning glucose, which is the energy of life.
Yes.
However, to some point, when my body is not able to access glucose, there is an alternative source of energy, which you're calling the fats. Okay?
Yes.
So when the fats are broken down, they still give you ATP, that is the energy molecule you use, and ketones.
Yes.
It turns out the brain uses ketones.
The brain uses ketones.
Yes.
Okay.
However, the benefits of fasting. So you realize as much as you want to fast, you have to have a target. What are you targeting? So some people will target ketosis. Others will just target to get their insulin down. So when I bring the issues of insulin, insulin is that hormone that determines which fuel you're going to use. When the insulin is high, you use glucose. Okay. When the insulin goes down, the body is not able to access carbohydrates or glucose in that case.
Yeah.
It goes for fats. Okay. So that is how the body is able to determine which fuel to use.
Yeah.
Okay. The advantage of using fats is means number one, it's going to regulate your weight. That's why people use fasting.
Yeah.
For
For weight loss.
And it also increases your insulin sensitivity. Yes, because the insulin receptors get to reset as you're not using the glucose.
Yes.
You see, the insulin pushes glucose into the cell. So now we don't have glucose, we're using fats.
But now if you do the what do you call it? The 18, what? 16/8.
Yeah, 16/8.
Now if you do the 16/8, you can fast for the 12 hours or so. But in the 8 hours, if you go binge, you just eat and eat and eat. Won't that now kind of throw that off and you even end up putting on weight instead of if your body is in ketosis?
Okay, yes. So that brings us to the point of why someone is doing it. Sometimes people do it for what we call autophagy. It's a new, yes. So if someone is doing it for autophagy, cell repair, in simple terms, it's cell repair. Someone is doing it for autophagy, they can binge eat because we have a period of cell repair and then regrowth when you introduce the food. So you can binge eat. But if you're doing it for weight loss, you have to control your feeding.
So again, you need to realize that fasting is very natural.
Yes.
That is why you take breakfast. The word breakfast is very deliberate, okay? Just don't eat for the sake you're breaking a fast.
Break your fast, yes.
So it is so natural that every single day you should fast, because fasting in medical terms is defined by more than 8 hours of zero caloric intake. So it means when you're taking water, you're in fast.
Yeah.
But if you take any other thing that has calories, then you're not fast. Think about somebody who ate at maybe 8 and they want to take their breakfast at 8. That is 8 hours, more than 8 hours. So that they're already fasting. So probably for you to have it better or easier, the issue is you can just push your breakfast a little later.
Yeah.
And you're still fasting. Okay. So it's not a matter of 16/8 and the timing. It's about reducing your frequency of meals. That is the whole idea.
But there are people who get hungry early in the day. There are others who, like for me, I'm not even hungry at early in the morning until maybe 11.
And that means you're normal, because studies have shown that people are most angry at 8 at night, not in the morning.
Oh,
yes. Because the body is already preparing. At night, before morning, the body is already preparing for the day. So there is a surge of hormones. Okay. And that hormonal changes prepares you for the day. Okay. So that is why in the morning, you see, when you make breakfast a routine, not necessarily a requirement from the body, then that is where we go wrong.
Aha.
So it's not a matter of just waking up and finding that cup of tea and all those.
But yet, because of either our school background, our school lives, or family upbringing, most of the stuff we do is just a routine.
Yes,
Yeah, it's
it's wrong.
true.
So at which point does fasting become an eating disorder? Where do you now draw the line when this one has refused to eat completely and will only eat maybe some peanuts at 4 p.m. and then that's their day done?
So fasting becomes an eating disorder when it someone has obsession about maybe losing weight, then also get anxiety around food, we're looking at cases of anorexia. That's when fasting becomes a problem.
However, you also need to differentiate between fasting and starving. Starvation is a whole another thing. Yeah, different from fasting. So the difference is, number one is going to be dictated by how long you do it. The other one is the intention. Yeah, you cannot fast to death, but you can starve to death.
Oh, okay. Yeah.
Actually, the other aspect is okay, the how long and the intention. Okay, starvation is associated with the subcutaneous, so the fat loss, the fat under your skin loss, and muscles. While fasting is just your body looking at the alternative source of energy, your fats, and the breaking down. So you're not losing both fats and muscle. And remember, when you talk about the other drug-induced fasting or starvation, like people who use Ozempic, they generally starve. Let's say they use muscle, and they lose their fats.
Oh, because it suppresses appetites.
So it suppresses your appetite and tells your body or your brain is constantly aware that you're full. Yeah. It uses your GI motility, meaning if you ate something, then the turnover was lower. So it means the content of your intestine goes lower. Means you don't get energy in the more, and that's where you get the nauseous. That's where you get some complications called gastrophoresis, where your intestine can even junk up, and then it's a problem.
Actually, they say any fasting above 72 hours should be done under medical monitoring.
Oh,
yes.
Like continuous.
Yes, if you're continuing, like you're not having food or you're not having water for that period of time, more than 72 hours, do it under medical monitoring. Don't do it at home.
Well, we have candid conversations here about health and wellness, including how you fast. There's some people who say that fasting means I only eat fast food. No, that's wrong. But when we come back, we'll be debunking those and other fasting myths right here on the Med Squad podcast.
Hey there! Welcome to Zuri Health HQ, where Africa's finest medical minds meet modern care. I'm Yafesi, your host on the Med Squad.
Hair care is personal. It's not just diagnosis, it's direction. From a cough to managing chronic illness, we listen and we lead.
Every symptom has a story. We listen, explain, and act together.
Nutrition is not just about food. It's fuel, it's healing, it's prevention. We help you eat with purpose, for energy, for recovery, and for lifelong health.
We are not just lab coats, we are detectives, and your blood speaks when we translate.
Your mental health is not a luxury, it's your health, period. Whether it's trauma, depression, anxiety, or even wanting to speak to someone, we are here for you.
At Zuri Health, collaboration is our strongest prescription. We connect expertise across Africa to deliver care that is smart, affordable, and people first.
This is the Med Squad. Real conversations, real health, real people. From your inbox to your bedside, we're with you.
Welcome back to the Med Squad podcast. We're talking fasting. Let's get real. Let's get raw. Let's get relatable. And by raw, I'm not talking about raw food, yeah?
Yes.
It's just raw food. It's just good.
Raw food is good.
Some raw food is good. We'll see which kinds, because there are some myths that have been presented regarding fasting. We want to debunk them or find out if they're true. So, like for instance, does fasting detox your body? Detoxicate?
So to some extent, yes. So it depends with what you mean by detoxification. Do you mean I already have a poison or a toxin in me that when I fast, I'm able to neutralize it or make it safer for me? So that is the data. However, you need to realize that your body gets sick or when you overwhelm it with something. For example, if you overwhelm it with carbohydrates, you get carbohydrate the problem, diabetes. When you overwhelm your body with alcohol, your liver is not able to handle it. You get alcohol liver disease. So it just reduces the dose of the poison. This is what I'd say. Fasting is good for that in terms of detoxification. However, you need to remember that you need to give your body some time to reset, to clear things up. Think about fasting as a form of just reducing the overwhelming toxins that you give your body. Yeah. And food is to some extent, there are some food that are toxic to you.
Yeah.
So fasting helps with that.
Okay.
Yeah. But also the body has a natural way of detoxing. For example, you have the lungs that remove the carbon dioxide, then the liver, then the kidneys.
Yeah.
So detoxing, maybe like doctor said, to a lower extent. But also what mainly does, especially if autophagy sets in, it helps with cell repair.
Uh-huh. Okay.
The cells naturally.
So it
repair
can
themselves.
to some extent.
And not all types of fasting. Autophagy sets in after between 12 to 18 hours. But on average, it's 18 hours. So 18 hours onwards, we see autophagy setting in. The cell repair, the process beginning to happen. And then you realize between 24 to 48 hours, it peaks, gets to a climax. Then at 72 hours, we see a plateau. Then beyond 72 hours, now you're having cell destruction. You're not doing any good to your body.
Okay.
Yes.
So, Yafesi, maybe probably I'll break it down for you so you understand what autophagy means.
Yeah, break it down.
So, auto means self.
Yes.
Phagy means self-eating.
Okay.
Okay?
Yeah.
So autophagy means your body is eating up the dead or old cells in your body. Think about that one cell in there that is sluggish and its content are not okay. The membranes are broken. That cells needs to be removed, or else it's going to cause some immune reaction.
Yeah.
Okay, and that's what some of these diseases we have are associated with the same. Some of these diseases we have are associated with the same.
Yeah.
So autophagy allows your body to scavenge for those dead old cells and consume them up so that you remain healthier and younger.
Yeah.
Okay.
Reducing inflammation.
There are many questions that go in my mind, but actually, along with that, even as you're talking about reducing inflammation, there is the myth about fasting curing diabetes. Does it can cure diabetes?
Okay, you need first to ask yourself, what is diabetes? In simple terms, is an issue of food.
Yes.
You're not able to handle some specific foods, of which it's carbohydrate. That's why we're talking about sugar.
Yeah.
However, there is an underlying issue about your insulin not being so effective, what we call insulin resistance. We've said that eating affects both your sugar and your insulin secretion. So it means fasting has a very big role in terms of your disease development and your disease management. So, however, some patients, especially patients who are on care, are not advised to fast, because if you fast and take the medication, then your sugars will go down. But scientifically, it does not mean a diabetic patient cannot fast. However, fasting is not a medication or is not a modality to heal diabetes.
Okay.
There is something called medical nutrition therapy, where we are looking at controlled eating. What food are you eating? The portion, okay? The timing, vis-a-vis the medication you're taking, so that we can have an overall effect managing your diabetes, and we can even go back to remission.
Yes.
So it's possible. So fasting in itself, in general, is not a therapy for diabetes, because if you fast and get your insulin, you will kill yourself. If you fast and take your oral antiglycemic, the drugs for diabetes, you might get hypoglycemia, which is dangerous. Okay, so we cannot rightfully say that fasting is used to manage to cure diabetes. That is wrong.
Which kind of touches on another myth, which I'll ask you. You must feel weak or it's not working.
That is not true. But also, you need to know we are different. You see, some people fast and they say they work faster. Their brain function faster. Then others fast and they feel anxiety. So it depends. It depends on someone's body.
So if it's something that you begin, even look at the ones who do religious fast. The first few days is very difficult. You feel weak. It's again when you're not taking water. So water is especially, so when you're fasting, think about your body. Your body is not low on energy, because the moment you don't provide it with food energy, it will fight for itself. It will find from your butt, from your anywhere where there is fat. It will go and pick it and convert to. That is why even when you fast, and you go to the lab and do your blood sugar, it still be normal if you're not sick, okay?
Yeah.
So the moment you don't take water, now you get dehydrated. Dehydration is the worst. Now that is what makes you weaker, dry up, because fasting has so many other, in fact, fasting is associated with better cognitive functionality, kills the brain fog. Okay? Fasting has been associated, you see, the fact that I am fasting does not mean I'm low on energy because my body is able to access the alternative way.
Yeah.
In fact, between carbohydrate, which is glucose, and fats are better energy sources than glucose. So it does not, so it is more psychological than real in your body.
Okay, so these fats that we're talking about, can we obtain them in some other way, like eating good fats, like say maybe avocado?
So the fats we are talking, we are thinking, when you're talking about fasting, we are thinking that person is not eating. So don't talk about avocado here.
Yeah.
Talk about the fats already in the body.
Yes.
You're talking about the subcutaneous fat, the fat under your skin. Yes. Okay?
Yes.
So those are the fats that your body goes to pick. Remember, anytime you take carbohydrates,
Yes.
or some form of proteins, you either use them or you store them. So you use them when you're working. But when you're sleeping, for example, and you have minimal activity, the excess glucose you have has to be converted by your liver to fats.
Yeah.
And then it is packed up on your fat cells, the subcutaneous fat, the fat under your skin, as you've said.
Yeah.
It is stored there for a rainy day. That day that you're not able to get food.
Yeah.
That day that you're not able to
grab lunch.
Yes.
Broke.
That day that you are sick and you are unable to eat. Your body will go there, extract those and convert and process them to energy. Okay?
Yes.
So these fats that we have under our skin are okay. The problem is when they grow so big, remember, they are bags. They are like bags.
Yeah.
So we pack fatty acids inside the bags.
Yeah.
So they will grow so big to some point they can even burst. And think of that oil that spills in your body.
Yeah.
And that's why obesity is associated with other diseases. However, some level of subcutaneous fat is good for you. It is for insulation. It is a source of energy.
Yes.
And it gives you the physique you have.
Additionally, there's ongoing research about the ketogenic diet, where people are eating more of less of carbs and more of the healthy fats to get the ketones.
Those are the avocados that I'm saying. Yes, and the groundnuts.
But you see, that is not in the context.
So that's not in the context of
Yes.
Keto diet is a dietary approach. But fasting is you're not taking caloric intake
at all. Yes. So then, obviously, is this really a myth if I say fasting is a good way of losing weight fast?
No. Okay, some people will say it's true because I've seen it happen, but it's not sustainable. How long are you going to live like that?
For some people, it's a long. For me, I beg to differ.
Okay.
So the question is, how many modalities do you have for weight loss? Which one is the best? Currently, surgeries have been the best. Okay? You go in, get something done, your weight goes down. Exercise. How much will you exercise for you to lose weight? It works,
yes,
but it's not the best. How much do you lose? If you go to the gym and still come and eat as you wish, you're not going to lose weight. You're going to be fit.
Yeah.
Fasting is a proven way of losing weight. It is proven.
Okay.
And how do we know it? There is no weight loss without getting your insulin down, because insulin is a storage hormone. Okay?
Okay.
When you fast, when you reduce the frequency of your meals, when you check on what you're eating, you get your insulin down. When you get your insulin down, you don't store. Okay?
Yes.
Think about that person who is born of very obese parents.
Yeah.
There is a 20% genetic predisposition for them to grow as big as their parents. But you need nutrition for them to grow as big, or else if you starve them, they will still lose weight.
Yeah.
So weight loss, fasting has been shown to be okay. The issues of sustainability depends on how you do it.
Yeah.
The issue is not fasting for 48 hours. No, it is one thing to do portion control, and the other thing to just abstain from food. The same way you abstain from sex, you can still abstain from food. It does not mean you don't take it or you hate it. It is from a deliberate point of view that I know I don't need food every single time. And we can trace it back to our origin. The Paleolithic period, when you woke up from your cave, you are not sure you will get that antelope.
Yes.
Right? You are not sure if you eat that sweet potato, it will be poisonous.
Oh, yeah.
So we were not food secure. So how many times did you eat? That is why there's no book in science where you're supposed to take 3 meals a day. So it comes back from our origin.
Yes.
The economy and the industrialization has really changed, and we're able to get food now and then.
Yeah.
But our genetics in terms of our food intake and our requirement has not changed.
Yeah.
And that is why God was very deliberate. He did not allow us to be in control of that fuel of life. When you don't eat, your liver works.
Yes.
And you get the energy and you move. So the same way we do not have sex, anytime we feel like we want, the same way with food, because they are both physiological response of your body.
Okay.
So we can say some specialists say fasting is a way of losing weight.
Yeah.
And then some specialists will say it's an healthy way of losing weight.
That is wrong because
versus the
no, that is wrong because fasting is not unhealthy.
Unless
fasting by itself is not unhealthy.
Okay.
Because it's one of the healthy things. In fact, when you look at the modern guidelines for management of cardiovascular, we've seen even fasting working on people with cancers. Okay?
Yes.
Somebody has cancer and you are thinking, let us starve this cancer.
Yeah.
Because cancer is only able to metabolize glucose.
Okay.
So you fast, and again you look at the diet, now the keto diet and all those Mediterranean diet and all those things. However, fasting, even from other aspect, leave alone the let's say we are not medics. Even the religion aspect, they were feeling like there was some benefit for me abstaining for fasting for a month.
Yeah.
And that is why they do it. There was no scientific backing, but they just felt better when they fasted.
Yes.
So those practitioners that say fasting is unhealthy, I can debate.
I will have a question for them.
Yeah.
Now, actually, in terms of fasting, actually, there's another myth, actually, that I want to present, says that Africans don't fast properly because we eat too much food at night. I know there are some people who can't sleep unless they've eaten ugali and there's food sitting in their stomach like a stone. Then either they won't fall asleep or their dreams, they'll have nightmares.
That's just a saying, because when you look at let's look at reality and also different cultures. Now where I come from, I've seen the culture difference. Where I come from, food is not one type.
Yeah.
You can do ugali and rice, and maybe you can do 3 types. And here is basically one type.
Don't forget matoke, please.
And the matoke. You do, the standard is matoke and anything else. Matoke rice, matoke ugali. And here you find this one ugali. So I think that's when they say Africans don't fast. But remember, we're talking about the hours, the timing. So someone is going to eat, let's say, the healthy way, takes up at 8 and fast for the, I'll take an example of the 16 hours, fast up to midday. And then that's when they will have their breakfast. So where does the question come that Africans are not fasting because of their...
Because they eat...
Because of their...
too much. So the question you want to ask yourself is how manual is your body? The body is very automatic, okay? You can give it the whole plate of ugali, it will take what it needs. And the other one, you take it to the toilet. Get the point? So the fact that you've sat down, and you see, satiety or feeling satisfied is associated with, let's say, it's more psychological and mechanical. Mechanical, your stomach has to expand, and then your brain also has to look at the food and think, this one is enough for me. That's why you can see a plate of a meal, and you're thinking, I'll be satisfied with it, even before you eat it. So there is a psychology, and then there is a mechanical aspect, and then there is a hormonal aspect.
Yeah.
Okay? So it means as much as I can eat a big plate of ugali, my body will only take as enough as it can. And then the rest that is why if you want to add weight, you don't sit down and eat a big ugali. No, you eat frequently. Small meals frequently.
Yes.
Because you want your body to take up. Then the next time, before you eat in an already fed state. That is how you gain weight. So if you eat in an already fed state and you do not exercise, you gain fats. But when you eat proteins, predominantly proteins, and you do exercise, you get lean muscles.
Yes.
Okay? So the aspect of Africans sitting down and eating a big chunk of a meal is neither here nor there in terms of fasting, because the issue is the timing between that meal, that big meal you're thinking, and the next big meal you're thinking.
Yes.
How long is it?
Yeah, so we're not that badly off. And when we come back, we'll actually be comparing the African reality with some of the global trends when it comes to fasting, right here on the Med Squad podcast. Welcome back to the Med Squad podcast. And throughout this podcast, this episode, we have not eaten. So yeah, are we fasting? I don't know. We will find out. Does this count as intermittent fasting? Actually, I want to compare the impact and the purpose of, say, intermittent fasting, which is now even a global trend. So many influencers, fitness influencers and all, who are YouTube channels saying, oh, let me show you how it's done. Then the person has a six-pack with its own six-pack. And then, so the impression you're given is that that's how you look after intermittent fasting. And then you compare that with religious fasting. I've never seen someone with a six-pack and ripped talking about religious fasting when they talk about intermittent. So what is the difference in impact and purpose of these two?
So it's all the same. We're looking at hours. What you're going to gain after.
Yeah.
Let's say for religious, if it's usually, let's say, take a place for Muslims, they're going to do about 12 hours. And still, if you look at, that's still intermittent fasting, just called another name. But the purpose is almost the same.
So, Yafesi,
Yes.
when you're talking about intermittent fasting, the overall question boils down to, why are you fasting?
Yes.
Okay? And from the conversation you've had, there are different purposes of fasting. Somebody will be fasting to pray for something. It's all religious. It does not mean just because I'm praying for a religious issue, then my body is not getting benefits of a medical fasting or clinical fasting. You get the point?
Yes.
So you can fast and be praying and be enjoying autophagy. You get the point?
Yes.
So it's a matter of not doing the way you're doing, but doing it the right way. Understanding that I need to abstain from food for some time.
Yeah.
Okay? And you're saying fasting is so natural that we do it every single day.
Yes.
That is where we take the breakfast. Sawa.
Yeah.
So ideally is just do what works for you, not what the other person. And you have to remember, fasting does not give you abs. Exercise does. Okay? Abs and muscles are as a result of exercise. You need to train your muscles for them to grow bulkier. But if you fast, think of fasting as gym for your internal organs. Your liver does not go to the gym. But if you give it a break from the alcohol, from the too much fructose, it feels better. You get the point? Yes.
So we're looking at that as stress. You're exercising, you're giving a body, the body is undergoing a certain type of stress. Even during fasting, the cells are undergoing stress. So they're adapting a certain way. Same applies to exercise. The body adapts.
Okay. So now, speaking of stress, does fasting help or hurt mental health? If there's stress,
Okay.
are there stress hormones released or it's a different kind of stress we're talking about?
Okay. So when you talk of relationship between fasting and stress or mental health problem, you have to ask yourself which one came first. So if you're having mental problems and you don't want to eat, that is not fasting. That is eating disorder. Okay? And it's one of the symptoms of depression and all these mental health problems.
Yes.
Okay? Okay. If you are stressed and you feel like it's one of the coping mechanisms you use to just abstain from food and solve that problem. You see, as doctors or medical practitioners, sometimes we cannot prescribe your life on how you want to approach things.
Yes.
So if you feel, when my wife has a problem with me, she does not want to eat. She just wants to say, she's not starving. She just doesn't partake the meal. She doesn't have the appetite because she's furious or something. You need to understand that as if that does not cause her to lose weight unhealthily or cause her to develop other problems, then that's okay. However, you have to realize that when you don't eat, or for example, you abstain from food and you have psychological stress, you don't get the full benefits of you skipping meals or or abstaining from food. Because let me tell you something. We know that when you fast, you're looking to reduce the fat content in your body. You're burning them, right? But when you're stressed, it turns out you are able to add visceral fat. So it means you're stressed, you release something called cortisol hormone.
Yeah.
So the cortisol hormone is a stress hormone that has been association with packaging visceral fat. So it means, and visceral fat is associated with development of non-communicable diseases, diabetes, hypertension, and polycystic ovarian syndrome, and all those diseases, and even cancers. So you see, as much as you're fasting and you're stressed, they don't go together.
Yeah.
Yes.
Speaking of stress and fasting, you can end up getting peptic ulcers.
Oh.
Because naturally, we have the protective mechanism of the stomach producing acid. So the stomach is, when you're fasting, we have prolonged exposure of the stomach lining to the acids.
Yeah.
But then remember, when you introduce food, there's mucus, a protective layer produced. So when you're fasting, the protective layer, the acid is going to irritate the stomach lining, and you're going to end up with ulcers.
The ulcers.
Yeah, because
So stress, starving, stroke fasting causes ulcers.
Which then brings the question, is dry fasting, the one where no food, no water, nothing, is it dangerous?
For how long?
Or for how long? That's
Yes.
what matters. And you said the limit is 72 hours. Or
That is
that is extreme.
extreme. Yes, exactly.
Yeah.
So we do, if I'm to recommend fasting, it should be a balance. Fasting and feeding. Yeah. That's when you get the benefits. But if you're doing one and leaving out the other, you're not going to get the benefits.
Hey, what were 40 days and 40 nights? Should children, in fact, you can lump them together. Children, the elderly, and people who have chronic illnesses, should they fast?
No, especially for children. The children need the nutrients and
The tantrum that will come.
Exactly. You can't control. You can't do it. So we're looking at children. We're looking at elderly. We don't put them to starving. Elderly, pregnant women, then people with certain conditions. Now, especially like diabetes type 1, like doctor was saying, these people are going to end up with ketoacidosis.
Yes.
Okay. Yeah, first, I have something to add there.
Yes.
So first of all, fasting is not a prescription. Fasting is voluntary.
Yeah.
Yes.
So when a 12-year child says they want to fast, do you tell them to eat? They are not going to die.
So if it's their choice.
If a 12-year-old child in a Muslim setting, there is fasting, she's already gotten her menses, she has been raised from a religious point of view, and they want to fast.
Yes.
Do you stop them? The answer is no. It's because fasting, there is nobody I don't know if there's anybody who died of fasting. Because if you think I am dying, then you will eat.
Yeah.
It's very deliberate. It's not like you are deprived of food. You see the food, but you decide not to eat. Okay? Because of the benefit it accrues. So for me, my perspective against, you see, there are those children that cannot fast.
Yeah.
But there is a group of people who they have the capacity to understand, I can't stay without food. That's one. The elderly.
Yes.
So why, do you know if there is any intervention that helps us from aging, to stop aging? And how do we age? And how would you want to stop your aging today? And you know you are going to age, but how do you delay it?
You drink coconut water.
Coconut water, what else?
I don't know.
So what are you doing so that you don't continue aging as fast as you can?
Smiling, laughing, making people laugh.
Okay.
And coconut water.
So you understand? So
Yeah.
food has a very big role in terms of your aging.
Yes.
It's called glycation. And that's why people with diabetes, we do the HbA1c test to look at how their red blood cells have been glycated. Glycating, in other words, means browning.
Yes.
Browning, okay, think about when you're cooking red meat. You put oil,
Yes.
and then you put the meat, and then you start to saute. The more it gets brown, the better you think it's getting better for you to eat.
Yes.
So it turns out even humans brown.
Oh, we brown.
So how do we brown?
Mm.
And how do we know? So we know this from, if you take an old woman, 60, 70 years, and take an image of their cartilages, they are brown. But if you take that of a young one, a neonate, or probably a 1 year, they are white.
Oh.
Okay? So what causes browning? And that is the process of aging. And that is why we look at nutrition as one of the interventions to reduce your aging and your skin and everything. It's because there is a reaction called the glycation reaction or the Maillard reaction that happens between your DNA, your proteins, carbohydrate, everything in your body.
Yes.
And it is a result of glycation and browning. It turns out that some specific foods increase the browning by more than 8 times. So it means you have to look at those food and think, oh, I need to reduce this.
Browning is a sign of aging, or is it just?
You see, on the outside, we are looking at you, but in the inside, you are browning every single day. And that is why you age. And that's why people get cataract at old age. That is why old age is associated with diseases. It's because of browning.
So we age like bananas.
We age like we brown. We are
brown.
cooking.
Yeah.
So we are cooking.
Yeah.
Okay, it's cooking technically. So for you to reduce the effect of such foods, taking a break from such foods is even better.
Okay.
You get the point?
Yeah.
So in terms of being young, you need to eat right. We are saying, what are you eating? Then the frequency. The frequency is determined by how many times you eat in a day and what you eat, like we've just discussed.
Yes.
And then the other issue is fasting offers you even more benefits. If you're saying that your body is able to repair and remove those old cells, are you not getting rejuvenated? And are you staying younger? Because being young is not, there is the aspect of how old you are in terms of years, but there is the aspect of how your body physique is and your general health. So you can be 54, but you are as young as 35. It's because of what you put in your mouth and how you use your muscles and how you think.
It's like Cristiano Ronaldo. He's now 40-something, 41, and he has a body of a 32-year-old or something like that. Now, can traditional African, if there's such a thing as traditional African fasting, in fact, I don't even know if we can categorize it that way, but fasting in general, can it be medicalized? We've seen it modernized through trends and also whether they're right or not, I don't know, but can it be medicalized so that officially a diagnosis can involve or recommendations can involve fasting medically?
We're not doing it as yet. I'm not going to prescribe and I tell someone maybe you should fast for these particular hours, but maybe amongst their lifestyle modification, they can engage it. They can include it. But I'm not going to go and tell someone, go and fast.
For how long?
Well, we're not yet doing it, but research is still ongoing. So it's up to them to decide.
Okay.
Also, like we said, there are some groups that are exempted. Yes. So I can't tell children, elderly, like I said, pregnant women, their metabolic demands are different from the general population. So you wouldn't even recommend it at all.
So with regard to like organized fasting, like religious fasting, do we recommend that they have a dietitian or a nutritionist who can guide the community when it comes to fasting? say we're having a 21-day fast, and then this guidance, like, please don't just go stop like this, and then we see you after 21 days.
Okay, so that one would be recommended for people with conditions, underlying conditions.
Mhm.
For example, the Kenyan guidelines have introduced fasting for people with diabetes because there are criteria you have to check for you to be allowed to fast.
Okay.
Because the danger is not fasting. The danger is you taking your medication and fasting. Okay? Because we know there are patients out there with diabetes who been told your sugars are high, and they know if I do not take ugali or any carbohydrate, my sugars will not go high. So they reduce the number of times they eat. So the question is, do you think they fast? Sometimes most of them do. Others, they only take vegetables and probably some level of meat, proteins, and they stop medication.
Yeah.
The problem is that they're just there. There is no follow-up for them. So that is dangerous because if they get to ketosis, that's a problem.
Yeah.
However, today, in the modern society and the advances in medicine, we're able to have people fasting in a controlled environment, even those with chronic conditions that maybe probably do not look compatible with fasting. For example, earlier guidelines for management of diabetes did not have provision for fasting, but the modern ones, like the 2024 ones, they have. Okay, so you can still do fasting.
Yeah.
However, from a religious point of view, even religion was very deliberate. It knows that if you fast for so many hours, you might die. Leave alone the Shakahola one, where in Kenya people fasted. They starved. They starved to death. Okay. Yeah. But now you see most of the religion, even the way it's set up, it is not a dry fast that will take you to death or give you some other complications. It is very controlled. And for example, you're talking about Muslims doing it around 12 hours, which is still okay. Most of people still do it.
Yeah.
So I think fasting on a religious point of view is very calculated.
Yeah.
And we have not been seeing problems with it.
Okay.
Yeah.
Now these ones who fast by taking, I fill my bottle with fruits or fruit water,
Yeah.
all that. So I'm never hungry. So I'm wondering, if I'm never hungry, am I really fasting? I'm just having a different meal.
What are you trying to achieve?
Yeah.
But also, it's like you said, it's like you're having a different meal because it's still glucose.
Yeah.
You're still introducing the glucose. Yes.
Yeah, Fesi.
Yes.
Fasting is 0 calories.
Okay. So water counts.
No, water does not have calories.
So it's 0. So
if you take
water,
water,
you're fine.
you still fast.
Okay.
If you take black coffee,
That one even now
you're still fasting.
Yeah.
Because there is no sugar.
Black coffee,
0 calories without sugar.
Oh. Hey. Okay. But then
But alcohol has calories, so you can, if you fast with alcohol,
yeah.
still you are eating turkey.
Now people look, someone is in the comments already. Now you see, you're being told, we're the ones telling. In fact, you know what? Let's take a break. Give you time to write that comment properly. Yes, alcohol has calories. Yeah. You're on the Med Squad podcast. We'll be back. Welcome back to the Med Squad podcast. Now, once you finish writing your comment, we just get back to the truth and have candid conversations about health and wellness across Africa. This is Yafesi, and this is Flavia, and this is Anthony. Yes, we are the Med Squad. Except I'm the squad parts, they're the med parts. So there are popular opinions that have come up about fasting. Now we can debunk these ones. Let's talk about medication and fasting. What you need to know. Take meds before dawn or after breaking your fast. Is that accurate?
So the question is, what type of medication? So you see, there are medication that you can take on an empty stomach.
Yeah.
And there are medication that you're not allowed to take on an empty stomach.
Yes.
So number one, medication when taken with food has some benefits. Number one is reduces the irritation of the stomach by the medication. Think of it as corrosion.
Yeah.
Number two, it helps with absorption. Think about the pipe or the intestines. Yeah. They are hollow.
Yeah.
With so many ways of absorbing the medicine.
Yeah.
So if you eat, if you take a medication on an empty stomach, the only dimension that that medicine is flowing is one, meaning you're absorbing it from one side.
Yeah.
However, when you have a full and you've eaten,
Yes.
the medication is able to be absorbed optimally. So that is the reason why we advocate for people to take medication with food.
Yeah.
However, think about PPIs or medication used for acidity. It beats the logic when you use it with food because you're saying this medication is to go and reduce my acidity.
Yes.
But you're taking it with food. The moment you introduce food in your mouth, the acidity is already being free. Okay? So you want to take it 30 minutes or 1 hour before the meal so that when you take the food, the effect of the medication is already there.
Okay.
So it depends with what medication you're using.
Yeah. Okay.
But it also depends on a doctor's prescription.
Yeah.
Now, like antimalarials, some of them are faster absorbed on a fatty diet. So they've told you to take it on with a fatty diet. You can't go ahead and fast. Then we look at, let's say iron tablets. When you take it with tea, there will be less absorption. It will work less.
Oh.
Yes. So it depends on the type of medication. Some they will tell you to take with the meal, others they will tell you to take before eating a meal. But also you realize that there's some medication you can take when you're fasting, and again, it causes more harm than good. Yeah. For example, the NSAIDs, we're looking at brufen, we're looking at diclofenac, aspirin. When you take them without eating, before eating a meal or in your fasting, it's going to irritate the stomach lining. Okay. And you're going to still end up with ulcers.
So can you skip, like for instance, if you're taking drugs to treat hypertension, and you skip them during fasting, or those, and those require meals?
So not necessarily that they require meals, but then you can't skip drugs like antihypertensives and DM, drugs you've been taking on a daily basis because they work along the clock. Yes. So if, let's say, the particular antihypertensive is going to work 24 hours, meaning after 24 hours, its effect is no longer there in your body.
Yeah.
So if you don't take it again, that means the blood pressure is going to spike. And then you're going to end up with stroke and the side effects of, hypertension. Okay. And then same applies to DM medication. Yes.
What about now the issue of pregnant women?
Yes.
Yes.
I have a question for you.
You have a question for me?
I know in your childhood you're told to take anti-helminths, those for worms, deworming medication. Early in the morning, you don't take any. You still do the same?
No.
Why?
I think there's even an issue of pride. When you haven't done it for so long, you think you'll take and then an anaconda will come out. The last time you did it with one was, wow.
So the question is, should you take them on an empty stomach early in the morning when the worms are hungry also, so that they can take medication?
They choose between food and medication.
Yeah. So they choose so what if you starve the worms and absorb them as protein?
No, you see, the worms do not eat the actual food that you eat. They are just stuck on your membranes. They are absorbing from your bloodstream.
Yes.
So they don't care of what is passing around. They don't eat the junk.
Yeah.
They eat the ones you've absorbed.
Aye.
So it means the medication does not go to dislodge them. The medication is absorbed in the blood, and then from the blood is when now they absorb it and they die.
Hey, because it's not on the inside.
It's not like they eat the actual food you eat.
Yes.
They eat whatever you already absorb.
Hey.
And that's why they are parasites.
Yes.
Because you could just pick one parasite and put it inside a basin of food and it could survive.
Oh.
But you see, they need you to digest it. So for them, they can eat it from.
So they're not just sitting there waiting for what you should.
Yes, you should. Yeah. So even the medication, they still have to feed it via that route.
Okay.
Yes. So it beats logic for you to wake up very early and take the medication, thinking that they will eat the medication. They don't eat the medication.
So they eat what you've absorbed.
Yes.
If you haven't absorbed anything. Hey, wait. And now we were talking about pregnant women who, is it okay for them to fast even, or what guidelines would you give pregnant women?
No, I would say for pregnant women, it's not recommended. They're under the special group because they are looking at, they're feeding for two and they're looking at their nutrition requirements. You know, when someone is pregnant, the body is demanding, and then also the immunity is weakened. The immune system is weakened, so they need a lot of nutrients to, to sustain that whole period. So fasting really, is common during pregnancy.
And Yafesi, Dr. Flavy, you're feeding for those ones now feeding for 3, not 2.
Goodness, imagine if you have the child inside you, you're not fasting, and then you have worms.
No, leave alone the worms. Now, if you have worms, you're feeding for 4.
Now you're feeding for 4.
Because everyone is feeding for 2. It is you and your microbiome inside there. Right now, you add the fetus.
The fetus.
And then the worms. They're feeding for 4.
Yeah.
Even the religious aspect does not allow pregnant women to fast. So they're exempted. So there are those people who cannot fast. Again, fasting is really voluntary. It's not an issue. But for a pregnant woman, if she told me she wanted to fast, I would still discourage. Remember, fasting is a recommendation. Think about sleep. You see, there are people who will need a prescription for sleep. You need to sleep. If you don't sleep, your blood pressure control is not okay. But you can only tell them. But if they are up all night watching series, what do you do? So it's more of a recommendation rather than a direct prescription. Even the medication we give people, we don't force it on them.
Okay.
We tell them these are the options you have. 1, 2, 3. These are the side effects associated with 1, side effect associated with 2. Which one do you think you can go with? And they say this one, and you give them. So the same way with fasting is I need to tell you, for you to reduce 1, 2, 3, fasting can work for you. It's for you to uptake it after you understand the effects of fasting.
Now, if I feel dizzy, do I just think to myself, you know what, I'll take water and I'll be fine? Or is dizziness a red flag?
See, there are some symptoms that you can get, especially for prolonged fasting or even normal fasting. If you feel dizzy, if you feel, let's say, headache from dehydration, such symptoms, it's better you stop the fasting and maybe eat, because your body is warning you. The body warns you in particular way. Sometimes you don't listen, especially for headaches, now for poor hypertensive. Anyway, that's another topic altogether. But but yes, if you have a headache, you're fasting, sometimes it's better you stop there. And yes.
Yeah, facing.
Yes.
I have a question too. That in the olden days where we don't have access to food like we do, what made us wake up in the morning, chase an animal, or probably go gather, and we were not sure to get food?
So
there's a way we've been built that even without taking food, we will still continue working. Because if the supply of energy was left to us, we will die. That is why your liver, that is why even when you look at, for example, we've done, there are Muslims who will come during their 40-day fast. And you take their blood sugar, and it's normal. And they ate at around maybe 4 in the night, and the evening, they're still okay. So the question is, are the symptoms as a result of you not taking food or you being dehydrated? Because you are saying dehydration is a bigger issue rather than the actual food, because your body is not able to manufacture water. You need to give it water. And that's why people, when they get dehydration, you need to give them water. But issues of glucose, the one people think is the energy that you need. So when you have dizziness, you think, oh, I am low on energy, I need to take some sugar. Oh, when you feel the headache, you think I am low on sugar. You are not low on sugar specifically. You are low on water.
So stop being choppy at Tony.
So you have to take water, because dehydration is the worst problem in fasting. That's why, for me specifically, I don't recommend people from dry fast in terms of water, because water does not give you calories. It does not hinder all the benefits when you do it dry. You see, if God is getting angry by me taking water during the fast, again,
you
see. So my perspective with fasting is water is very important. When you dehydrated, you cannot think through. So I think if you incorporate water, you negate some of these symptoms. But again, remember, some symptoms that people get during fasting are again psychological. because people already afraid I can't fast. And the moment they feel the hunger, you see, hunger is hormonal. The moment they feel the hunger, they don't have the guts to sit with it until the body takes care of it by going to the fats and getting the fats and using them.
Yeah.
So if you cannot go through that turmoil, then you don't get the other side and you don't enjoy the benefits. So I think take water. And if you still have the headache, go to the hospital. You probably are sick. Yeah.
But again, when you think about it, you're dizzy.
Yes.
You're having blurry vision. You can't function well. You're not concentrating. You've gone to work and you can't concentrate.
Yes.
Why are you continuing with the fasting? What's the whole?
We've been told, and if you're found not fasting, people will report you to the people
So,
who told you to fast.
FSC, my question will be, what are the symptoms of hunger? Is hunger a disease? Because you're talking blurring of vision. Those symptoms, they are like hypertension. Normal, if you have hunger, you feel the urge to eat. If you do not eat, your body goes and takes the fats and breaks them down, and you continue with the work. And this is normal in a work setting. If you're busy, you say, I want to eat in the next 1 hour. I'll finish this before the deadline. You continue working, and then you forget. But the moment you start feeling the headaches, how do you have symptoms of hunger? That you have not eaten, now you have headaches. That is not how we are built.
Yes.
Okay? And I've told you time and again, that our genetics have not changed so much. But the economy and the industry has changed. So it means I'm still that old person who would take longer before they eat. I decided to do so.
Yes.
If I start having symptoms as a result of me abstaining from food temporarily, then I have other problems.
Okay.
Yes. So it boils down to, because if you ask yourself, hunger is so natural. It is a physiological response. This is your body. It is ghrelin hormone that goes and tells your brain, you need to eat. The moment you don't avail the food, the body is like, no. Let's go to the bat and take the fats. And they go, and the body does that. So if your body is not able to do those things, then there is a metabolic dysfunction. And the symptoms are telling me you are sick. Because hunger is not sickness. It's not a diagnosis.
Yes. So now how do you...
But also, it's not a one size fits all. You see, there's some people who can miss a meal and faint just after missing one meal. And for you can go 24 hours without eating and you're okay.
So when
people are different.
Yes, Dr. But when you tell me that, you're telling me you're hypoglycemic. It means you have a problem with your liver. You have a problem with your metabolism. Because if you miss a meal, your body should automatically handle that. Because how long does it... Okay, if you were to go without food, how long would you last? Say we lock you up. Would you die within 24 hours?
Study says a week.
A week.
A week, yes.
We had a study in Shakahola. There are people who lasted even more than a week. Okay? There are people who lasted more than a week.
On average, it's a week. Because we're different.
And that is starvation. So you're not starving, you're fasting. So if you're going to collapse because you've missed a meal for 12 hours, then we need to do some more lab tests for you. You are having an issue with accessing your alternative source of energy. So if you cannot fast from a biological or physiological state, leave alone psychological, you see, you can break your fast based on the fact that I think I don't have the mental fortitude to continue with the fast. That is one thing. But you've tried to fast, you have the mental fortitude to do that, but you collapse, you are sick. You should go to the hospital and get checked. So what is wrong with you?
So now, when, let's say someone has come from a fast, whether it's they picked it up from social media or whatever it may be, fine. They've gone even for, say, 48 hours or 20. Is there a recommended way to break the fast? Because you're talking about some of the chemical changes that happen. You know, you can shock the body just beside whole pizza, hashtag, whatever. Is there a way of shocking the body too much, or a way of guiding it into normalcy if you're ending the fast, whether it's daily or at the end of a period?
Yeah, so what you said is true, actually. You can shock the body. We have what we call refeeding syndrome. where someone has fasted for very long hours, maybe 72 hours or 3 days or 4 days. And then after that, they go and eat a whole plate of food. So it's like you're shocking the body. You get electrolytes. Bear with me. You get electrolyte balance, whereby let's say potassium. Potassium with the heart, it causes arrhythmias. So someone can end up with heart failure just because of fasting. So in short, if someone has fasted for prolonged hours, even when you're introducing the food, you do it gradually. You can start with a soft food, start with water. Then you go on, especially now that reminds me, people who have had surgeries, when they're reintroducing them to food, it is soft food first. They'll tell you water, tea, then you go to mashed potatoes, mashed matoke. Then you go ahead and like day 3, you can now eat normally. Same thing to fasting. I'm not talking about mashed food, but here I'm talking about gradual introduction. You can do water, then you do fruits, and yes, you don't do it all at once.
So the other perspective to look at the introduction to food. So for refeeding syndrome and other things called sick cell syndrome are associated with malnutrition. So think of the body. So think of food as your body as a business. You need to have all the factors of production for you to get profit. So you have to put on some money, do some job so that you can get the end profit. So your body does not get the energy from the ugali you just give it. Just to break it down. The process of breaking ugali down is energy intensive. So the body has to have an innate energy for it to break it down, for you to end up with now the net profit. So for example, think of that ugali you take. When you take it, your body has to use X amount of energy to break it down. And then you get Y amount of energy. And then when you do the subtraction is when you get the net effect of the ugali. You get the point? And that's why some food, we say they have just calories, but they don't have nutritional benefits. Okay? So that is the aspect you get. So whenever you eat, whenever you're introducing somebody to food, you need to realize, do they have the enough reserve to break what you've given them? And that's why we start with not necessarily a big plate, but foods with low calories. Even you look at management of malnutrition, we start with F75. Those are some of the medical meals we give children before we go to 100. The difference is the number of calories we have. So you want to introduce them with the low. So it's not an issue of how bulkier the meal is. It is really what is in the meal. Because I've told you, the body is able to say, this is too much. I'm going to channel it somewhere else. That is siwa. The question is, what is it that the body gets? So we need to go beyond how food tastes and how much we take, but what actually our body takes.
So in addition, you see, when someone is fasting, the body adapts to that low metabolic rate. So when you're introducing the food, you can't again raise the metabolic rate. Do what the body can handle at that particular period. Exactly.
So now, as we go, because we could go on about fasting for quite a bit, but want to think about what one actionable maybe truth or perception about fasting can you offer to someone who's thinking about it, like they want fast, I am the expert in fasting. What one actionable advice would you be able to give?
Like I said, it's not a one size fits all. We all have different bodies. Know your body, know what you can handle, and go ahead and do it. But also, special groups are exempted.
Yes. Don't forget the special groups.
Exactly.
So for me, I am not really into specifically fasting. I am into good nutrition and lifestyle modification in terms of general well-being. If you fast and the next weekend you're taking alcohol, you're doing nothing. If you fast and then after you finish, you're taking processed products, you're still negating the whole effect. If you fast and you're still stressed, you're still negating the issue. So for me, my approach to fasting is, number one, fasting is healthy if done in a correct way. And studies have shown that if you do fasting between 8 hours to 24, you are healthy and happier. So you don't need to go extreme. During the fasting, please take water. That's okay.
Yeah.
And then overall, in terms of nutrition, you have to look at 3 principles. Number 1 is what you eat. Avoid processed products.
Yeah.
They increase mortality by everything. You can even die by depression just because you're taking processed food. Suicide. Okay?
Wow.
They have been associated with around 50% increase in development of cardiovascular diseases. So drop the foods from barcodes and sachets and all those things. Next one is your mental state. You can do all the other good things, but if you're stressed, there's still an issue there. So look at your psychology. If you have mental health problem, if you think you have stresses, seek help. Then finally, the exercise. So the exercise is very important. Helps you burn the extra calories, makes you fitter, gives you good cognitive ability. So overall, when you look at all these 3 things, they are the prevention to cardiovascular diseases. That is the definition of lifestyle. Your food, which is the diet, then your physical activity or exercise, and then your stress management.
Yeah.
And if you do that, you'll be healthy and happy. And that is the management even for the chronic conditions we have.
Yes.
Before you give somebody metformin or antihypertensive, you tell them about that. So start doing before you get sick.
Prevention
It's better than cure.
way better than cure.
However, we can change that and say prevention is the only cure.
Prevention is the only cure. Hey, you heard it here, Mr. Ree. Quotes. That does it for this episode of the Med Squad podcast. If fasting has confused you or stressed you, maybe you were supposed to start and you were not sure how to go about it. Now you do know how to go about it or whether to go about it. If any information was useful to you, helpful to you, well, statistically, then it's helpful to someone else. So share this information. Share the podcast. Follow us on all our socials at the Med Squad Pod. That's on IG and X. And also inbox us. Let us know if there's any myth you want us to bust or any topic you want us to address. We'll see you next time right here on the Med Squad.